welcome to Time to Learn. So, during this recording, we're going to be looking at a topic around concussion awareness and particularly what this looks like in the realm of our coaching environments in which we operate in. We're going to be looking at the relatively new grassroots awareness and guidance and that sort of strapline that everybody's heard about. If in doubt, sit them out. And taking us through this insightful topic is our leading expert is James Calder. So James, are you there?
Yep, I'm here.
Over to you.
Well, thank you very much indeed, and thanks also everyone who's listening to this. And it's basically to take people through what the concussion guidance is, how we got to where we are now, where we're going in the future, and also some feedback we've had from since it was launched last year. So my background is I'm a consultant trauma and orthopedic surgeon. I specialize in sports injuries. I'm based down in London, but I'm also the prof of the Department of Engineering, Bioengineering at Imperial College. So my day job is either orthopedics, but also research. I'm not a specialist in concussion, but where this actually came from is that there was a DCMS Select Committee inquiry which published its recommendations back in 2021. And what it noted was that there are about 30 million people involved in sport and exercise at the community level, and there were 600,000 to 700,000 sport-related concussions each year. Now, the problem with this is that a lot of those injuries obviously then go on to go and see their GP or turn up in A&E, and not all of them need to actually go to A&E or indeed go and see their GP, because they may be very, very mild concussions, but people need a bit more experience in what to do, manage them at home and outside in the non-medical environment. But also, a lot of concussions seem to go completely unrecognized. And those are the ones which we really need to pick up on and highlight the awareness so they can be managed properly. So the aim after this select committee was to set up a group of individuals to bring UK guidance across all 4 nations for those suspected with a concussion in grassroots sports. So we're not talking about professional athletes, because in the professional sports there's often a medic, whether it be a physio, a doctor, or a specialist in, say, places like boxing, where you may have where you will have an anaesthetist present. But this is actually for grassroots sports where there be nobody present. And it's practical advice for the acute management. So we're not talking about the longer term problems that have been reported in the press. This is the acute episode and how to prevent those longer term problems from taking place. At the same time, we're there to encourage exercise and sport participation. We know how important it is for both the physical and mental well-being, and also the social well-being of individuals to participate in sport. So we've got to encourage sport at the same time, recognizing there's a small chance of having an injury, whether that's an injury to a knee, a leg, a shoulder, or indeed a concussion. One thing to bear in mind with this, it is a live document. So this is what we're saying now in 2024 is not necessarily what we'll be saying in 2 years' time. We may change this and evolve basically as research findings are published and as things change. And also this forms part of a wider initiative on acquired brain injury, which I'll touch on later on. So the guidance is for sports. However, as when I presented this to the chief medical officers of the 4 nations, it was also recognised that it is actually relevant to other causes of concussion. So those that take place in the workplace, domestic violence, road traffic accidents, or even falls in the elderly. So the basic principles in this document, if in doubt, sit them out, take precedence in all other areas where there's maybe a concussion. So the process was set up in that I'm independent. I don't work for any sporting body, sporting organisation, so I haven't got an axe to grind for one sport or another. We then had the Recreation and Sport Alliance, who hosted this within DCMS, Department for School, Culture, Media and Sport. We then had international experts. These were experts not just from the UK, but across Europe, USA and also Canada. Representatives from all the major sporting bodies, the sports institutes, the FA, RFU, British Horse Racing Association. And then this was to represent the governments of all devolved nations. So it was we had to make sure we get all of them on side. So it's properly a UK-wide guidance. We also had to look at the colleges, the Royal College's general practitioners and emergency medicine, as well as the Society of British Neurological Surgeons, because they are also the people that will implement this through the professional bodies. I mean, it does align with NICE guidance and the acquired brain injury policy that's taking place throughout from the government, and also with 111 service, which is going to be critical to make this work. It also utilises previous work from devolved nations. So there's been a big campaign in Scotland, particularly, which really started this off back in 2015. And we've been using that work that's been really well done in Scotland. So from an overview point of view, the primary purpose is to promote the recognition of possible concussion and then remove and protect that person to make sure they don't get another head injury. That is the basic purpose of this. We then have, if you go to the website, and I'll share the link with you later, if you look at the guidance, we've tried to keep it practical and with key points to recognise. And the one key point is that most people with concussion recover fully with time. We do recognise, it's got to be recognised that a concussion is a brain injury, and all concussions can be serious. But the biggest thing is to identify the head injury, remove and protect that person, and prevent them from getting a second head injury until they're fully recovered from the first. We suggest here that all concussions should be managed individually, but the key at this moment is that we shouldn't let them return to competition where there could be a further head injury or head impact before 21 days. And then finally, if you still have symptoms after 28 days, those are the ones that should seek medical advice from their GP, which it may then in turn get a specialist referral for a review. So we split it down into how concussion can affect people. So it may be that you're coaching somebody, or somebody turns up at school and they may not have had a concussion with you, but they may have had something the previous day or a few days beforehand. So these symptoms and signs are important. So you may get physical symptoms such as headaches, dizziness, and vision. People may be noticed to have mental processing problems, so they're just not thinking as clearly perhaps as they were before. And there may be mood changes, so they may be short-tempered, sad, or emotional. And sleep changes is not uncommon. It's very common to have changes in sleep patterns. So when we've got those, playing on with those symptoms can make them worse. And the key thing to get through to people is we're not pulling you off to prevent you from playing sports. We're pulling you out of this sport and this environment so you can get better quicker and make a full recovery. So that because we know that playing on with these symptoms can be worse, and certainly if you have a further head injury before you've fully recovered, this can, in very rare cases, lead to death, and it's known as second impact syndrome. So that's why it's so important to remove anyone with a suspected concussion from a high risk or at risk activity. The primary purpose we've done there. Then what do you do after that? Contact a healthcare professional within 24 hours. Now, this is using the 111 service. You do need to identify who may need A&E assessment, and I will come on to that in a minute. But it's got to be recognised that not everyone needs to be seen in the A&E, or actually it's not practical for everyone to be seen. There are 1.4 million head injuries attending the emergency department each year. And there are certain requirements of certain symptoms and signs that say you should go to the A&E, but for a lot of the head injuries we're seeing, they don't actually need to be immediately seen in the A&E. Also, from then on, we need to encourage an early progressive return to activity. So when I was a junior doctor, in emergency department, we used to give out a head injury card, and we used to say, look, go and lie down in a quiet room and stay quiet for several days or a week in a dark room. We actually know that that isn't the best advice for all people. If we actively manage people properly, you can get better a lot quicker, and introduce activities at an early stage is really important to help them make a quicker and full recovery. And I'll come on to that in a minute again. It's also impractical for every single concussion to see their GP. As we're all aware, particularly if you try to get to see your GP recently, it's difficult. They are overburdened. There are specific circumstances where you do need to see your GP following a head injury, but the vast majority of these head injuries can be managed in the community with advice from this document. And if there's certainly a delayed recovery or no improvement in symptoms, then you need to see, or that person needs to see the GP. But there are certain requirements in this document which we say, look, these are the patients who can be seen locally and looked after in the community. There are red flags, and these are the red flags. They're very clearly put in this document. So if you're coaching somebody and they have any of these symptoms at all, then they do need to go with urgency to the hospital for accident emergency department or their emergency department by ambulance if necessary. So if there is a loss of consciousness, if there's a deteriorating level of consciousness, they're becoming more drowsy, if they cannot remember the events before or after the injury, if there's increasing confusion or irritability or unusual behavioral change. There are also neurological deficits, such as difficulty understanding and speaking, reading or writing, any sensory disturbance, loss of balance, weakness, and double vision. Certainly, if they have a convulsion or a seizure, please get them to an A&E department as soon as possible. And a severe or increasing headache. A headache is common after head injury, but it doesn't necessarily mean they need to go to A&E. It's when they get a severe head injury with a blinding headache and it's getting worse. That's when they definitely need to go to A&E. And once again, also repeated vomiting, any neck pain or any suspicion of a significant skull injury, such as a skull fracture. Also, if there's been a previous history of brain surgery or any history of bleeding disorder, they do need to go to A&E and blood thinning therapies, such as warfarin. People are on warfarin or for medication for heart problems. Frequently, they're on blood thinners, so they should go to A&E to have a checkup. And finally, if they're known to have taken any drugs or there's any alcohol intoxication, the safest thing to do is get them to A&E. In the document, you'll come across a graduated return to activity and sport. And this really is the first time we've had anything out there to actually say, look, we know that a graduated return to activities helps promote healing and helps give a more rapid recovery from a head injury. Now, in this, we've got a staged return. Please note that it is a minimum of 21 days before return to contact sports. Now, that's 21 days at the moment, and we are going to be reviewing this, and we do constantly review this because it is a difficult area. It is controversial because, quite frankly, if you make it too long, people will not declare symptoms, and they'll withhold symptoms because they'll be frightened they're going to be out and miss matches. There's still a problem with that, even with 21 days. But at the moment, it seems to be a pragmatic balance where we can keep people away for 21 days. As long as they have not got symptoms, then they may be able to return to contact sports at 21 days. But if we make it shorter, then we're probably leaving them open to further problems. And if we make it longer, at the moment, we think that it's probably going to put people off declaring their symptoms. The final bit is the education. So we've got the guidance out there. It was launched in 2023 in April, and it's had some very good press. It's been very widely accepted across all sports and across the education sector. It's also been very well supported through with the Department for Health. and Chris Whitty, Sir Chris Whitty, who's the Chief Medical Officer for England, have been very helpful in helping promote this and get people to be aware of it. We are in the process now of increasing awareness across communities. And this is really where you guys come in, because we don't have a reach through every single channel. We can go through a lot of the sports channels, but it's a community responsibility. We need the sporting participants, the teachers, the coaches, the parents as well, and the individuals participating in sports to be aware of this, so that they know what to do and they know what to look out for. And it's not just the coach's responsibility to spot a concussion, but also other people on the field of play. And the feedback we've had from coaches so far is that this has been very useful, because previously they've been under quite a lot of pressure of keeping Joanna or Tommy on the pitch, because it may be a very well-meaning but quite persuasive parent who may want to keep them on because they're being picked up for a county side or something, and they don't want to be seen to be withdrawn from the pitch. Whereas in fact the coaches can now turn around and say, actually, no, we're following the guidance. We're following the guidance, and that person does need to be removed and assessed properly for their own protection. So the feedback so far has been very good. We do need to do some more with the healthcare professionals. We are developing teaching programs through the Royal College of General Practitioners and emergency medicine to help, because they're going to be the first port of call when people have had a head injury. And if it's 28 days down the line, they need to be seen by the GP. And the Royal Colleges are now taking this up, and we're getting the education programs through. And finally, we're re-educating and refreshing everything. So the guidance is out there, and it has been difficult keeping the science together, because there's a lot of science out there. Some of it is biased. Some of it is not perhaps as accurate as we would like, because there's so many confounding variables. But we have seen these disturbing cases in the press, and then with lawsuits coming up out there. So that's why this guidance is important, because it feeds into a broader approach. And there was a £9 million research grant which has gone to various organisations, and this is basically to look at different approaches to concussion and see which individuals would particularly benefit from further education and further management in concussion. And then this is then developing regional concussion centres, so that then we can have the expertise regionally to deal with those patients who take a lot longer to get better. And we don't fully understand why some people may take longer to get over a concussion and make a full recovery than others. And within this, you may have seen, say in the Six Nations, there are the smart mouth guards that were being used. And there is headgear out there that we can use to have a look and see what forces are going through people, because it is difficult to assess a player by the pitch to see whether they've had a concussion. It is more of an art than an exact science. There are ways we go through this, but it is, as you will see on the pitch side in the World Cup and in the Euros, it can be very difficult to assess somebody and get an accurate result as to whether or not they're concussed. So the mouth guards were introduced in the Six Nations, and you could see spikes whereby the player may have been playing absolutely fine and there's no concussion, a concussive episode or a head injury noted on the pitch, but there was a spike and they were withdrawn from the pitch to go to have an assessment and have a medical assessment. The idea is also that we'll have an app, and an app is being developed to assess people and reassess them during their recovery. It also means that we can then have a red and green traffic light system, so that if an individual is concussed on a Wednesday, they can't just go and join another club, a different club on a Saturday. They have to present the app to show that they are in the green and they're fine and they don't have a concussion. And then we can then take them through, and what we hope is that on the app we'll then have different tests we can put in there to assess them, to see how they're recovering, so we can then give them the green light to return to contact sports. This is the first steps. The guidance has been crucial to start that process and raise awareness of concussion. And this is where I'd really value your support to raise the awareness of the concussion so we can get people out there and off the pitch if they have a head injury as quickly as possible. This is from the Six Nations game up in Scotland. You can see the motif, if in doubt, sit them out on the Scottish rugby players' shirts, and also up in the stand at Murrayfield. And I think if we can get this motif out there, it now has been adopted across sports, and it's a simple message and a very clear message to people. It is never perfect. There are many more things we can do, and we are taking things on board. However, what it has done is it has promoted a debate, and it has promoted some awareness of head injury. It was also suggested that it would be useful for non-sport related acquired brain injury, as I was talking about earlier on. And certainly the NHS is looking at adopting this guidance more widely across the NHS. And that from a health promotion point of view, what we need to do is it needs to be clearer on the NHS website. I haven't got it there yet. I am working on that. But the take-home messages are clear. We need to promote exercise and sport because that's good, what we need for the physical and mental well-being of the nation and the social well-being as well. But we also need to promote active management of concussion because we know they make a quicker and more full recovery. And that in turn will then reduce the financial burn of acquired brain injury in the future. And our hope is that by picking these injuries up quicker, we can then reduce the long-term effects that have been seen in some people who've had repeated concussions. But the long-term effects in a single concussion do not appear to be bad. In a single concussion, you can make a very quick and full recovery. In last month, the 1st of February last month, the guidance was adopted across New Zealand and Australia, and it was formally launched there with the UK, and it's been adopted across sports there, and also with the ACC, which is really important because that's the insurance scheme for no blame for all sorts of injuries. So if you've had a road traffic accident as well as during sports, so it really has been very well received over there, and this is the same guidance as the UK guidance. That also makes it easier for us moving forwards because we get a lot more data back. We'll also get a lot more feedback as to where we need to change for the future, and I'm very open about this. If the wording isn't clear, I want to know, and I need the feedback to change it, and so it can evolve. But also it means the data, we can see where people are going and how they're recovering from their individual concussions. And the more data we can get, the better it is for the research and the injury prevention in the future. So the next steps, we've done the guidance, we've shared it, we're educating it and communicating it. We now need to educate the athletes, the family, the club staff. We also need to go to the other areas across to elderly, health and safety, road traffic accidents, domestic violence. And particularly when it comes to reviewing, as I said, we have had a lot of feedback, which has been really helpful. But so far, there's been no need with the change in science, and the Concussion in Sport group are the large organisation that have researched, that have looked at all the research, and they published after our guidance was published. And there's nothing in there that suggests we need to change the guidance. So our guidance concurs with their findings as well, which is an international group, which is reassuring, but there's no change currently recommended as of March 2024. So one of the purposes of this is to actually get the feedback and actively manage it. So we actually act upon the feedback. And we've now developed a frequently asked questions section, which is going out with the updated version in next month in April 2024. So one of the questions was asked, what is the difference between the grass and the graduated return to play? And basically, there's no longer a requirement for an initial 14 days of complete rest period. And that's important because we know that actively managing this in just 24 to 48 hours is enough, where you then actually actively try and get people out, get them to do a bit more because they can make a quicker recovery. The next question is whether there's a 48 hours required between each stage. And there isn't a strict minimum time period between each stage. Stages 5 and 6, yes, there is you must be completely symptom-free at rest for at least 14 days before you can go on to stage 5. So you can only reach stage 5 at the earliest, day 15. And that's the point at which you can return to training with a contact sport. How do we know when it's appropriate to move between stages? Well, it's pragmatic. There's increasing evidence that lower level exercise early after a concussion is really helpful in improving brain recovery. So reflecting this, progressive low level exercise is really encouraged. And if you have a mild symptoms, you may therefore still progress through stages 1, 2, and 3, even if they're present, provided the activity does not more than mildly exacerbate those symptoms. How do we know when it's appropriate to move to stages 4, 5, and 6? Well, you can move on as when you're symptom-free at rest beyond stage 4, and you can move on to stage 5 at the earliest, as I said earlier, at day 15. And the earliest you can get to stage 6, which is competing at where you may sustain a head injury, is at 21 days. So what can you do between stages 4 and 5? You know, do I just do my normal training schedule within the limitations of stage I'm in? Well, this is set out in really quite detail in the grass, and the progression should be a gradual across all stages. And particularly in non-contact training, there should be a gradual increase in exposure with the aim of being back to normal training schedule by the end of the week. Is there a requirement for review by a doctor? The answer is no. There's no longer an expectation for review by a doctor or a healthcare professional when progressing through to recovery. That's including moving to contact training or return to play. It's basically an individualized case management, and clinical review by a doctor or healthcare professional is only considered standard practice in elite settings. It's not practical or needed in the community setting. However, if the individual's symptoms are deteriorating or not improving by 14 days, then you need to contact 111. And certainly if there are still symptoms after 28 days, they need to seek medical advice via their GP. Frequently, we're also being asked about the difference between males and females. This is a controversial area because studies comparing data on concussion risk and recovery in male and female athletes are really limited. But it does suggest that female athletes may be at higher risk and may take longer to recover than male athletes. Now, we know that there's more research is needed to explore these findings. But meanwhile, managing all concussions individually remains the rule, and it's suggested that equivalent concussion management resources can be made available to both male and female participants where at all practical. Finally, there's concern about whether there should be different management for those who have disabilities. Now, this is a really difficult area because of the particular difficulty in maybe assessing somebody potentially with a neurodisability, and it's very much an individually case managed scenario. Now, there is a group investigating this at the moment to come out with separate guidance. But as with anyone who suffers a concussion, disabled people who have been suspected with concussion must be removed from play. So the principles are the same. If in doubt, sit them out. There may be individualized adaptations required for supporting a disabled person, such as facilitating the transfer from a wheelchair to promote rest, and initial phases during that sort of hand cycle instead of a stationary cycling in the later stages. But disabled people may require a longer initial period of relative physical and cognitive rest before starting to return to activity. And this is particularly relevant for those with conditions such as cerebral palsy, stroke, or previous moderate or severe traumatic brain injury, when they may already exhibit some degree of neurological impairment. However, what we do know is they should be removed from the field of play. If in doubt, sit them out, and then undergo a gradual recovery that's individualized for their care. I do hope that over the next few months we will be able to see some progress with the guidance for specific disabilities, but as I'm sure you'll appreciate, it's a very difficult area and very complicated area. So in summary, what this guidance has done is it's been UK-led, but it has been adopted internationally now, and that adoption helps for a clearer messaging. The adoption in Australia and New Zealand has been very helpful, because not only does it help us with the getting the message out there, and also clarity when we're playing sports across nations and between nations, but it also helps us with the transfer of information and collection for research. It also helps us look at what messaging is out there for different groups and get some feedback, and they can also help us design more educational documents. Please remember, it is a live document. It's a work in progress. It's not perfect yet, and I wholeheartedly agree with anyone who wants to criticize it. I will take that on the chin, and please let me know if you think that we could do something better. Please let me know. I'm very upfront about it. Please let me know, and I'll do my best to change stuff where we can. What can you do? Well, it would be really, really helpful if you can help promote the guidance and get the message out there. The strapline is very simple. If in doubt, sit them out. It's got out there, particularly across Scotland, for many, many years, and it is now reaching out there across even down under in Australasia. So please, if I can ask one thing, please help us get the guidance out there. Make more people aware of it. And there's the web link down at the bottom there. Look it up, and if you want to print it off and put it on the posters, that would be great. But thank you very much for your time. I hope that's helpful. And back to Kelly.
Thank you, James. Thank you for taking us through that insightful topic. And I know that I'm not speaking out of turn here when I'm saying that this information can be truly life-saving. Although you did explain that in the most, thankfully, that the concussions are fairly mild, but this information is so important. So for those that are listening, the beauty of these being in recording is that you can rewind, revisit some topics, perhaps go back and make some notes that you might want to share specifically within your coaching environment. And also, you can share this within your coaching environments, perhaps with parents, carers, those that support the coaching environment, because it really is with more of us understanding this and understanding the guidelines and all of us playing our part, that we can make sport and activity a really safe environment for all. And as James has said, please do go and visit the website there that James has mentioned. Get yourself clued up and keep abreast with the information coming in, as this is a work in progress, as James has explained. So thank you to James for taking us through that insightful topic, and thank you for those that have been participating in the recording. Like I said, we do advise that you can rewind, record, revisit some of these bits and bats and share it across your coaching network. So without further ado, thank you, James, and thank you for those that have been with us for the recording. Take care.